Section 1. Secret number 1. Prepare, prepare, prepare. Now, when I spoke with doctors about some of the things that they do to prepare for their examinations, I got so many ideas and so many useful insights that I couldn't publish them all. So in this section, I share with you only 3 secrets out of all the secrets that I received, because I believe these to be probably the most powerful of the secrets. You know, it was Alexander Graham Bell that said, before anything else, preparation is the key to success. And Robert Schuller, the famous preacher, said, spectacular achievement is always preceded by unspectacular preparation. And a lot of doctors scrimp and skip on the preparation because it's unspectacular. It's not the funnest part of the whole process, and so many doctors simply show up at the examination underprepared, and we don't want to do that. Preparation is essential to producing a thorough, persuasive QME report, because really when you meet with the injured worker, you've got one shot at it. You have to hit all the high notes in your interview and exam if you're going to produce a credible and persuasive report. You can't go back. In other words, you can't get back to your office and realize that there was something that you omitted, or something that you should have done, or some questions that you should have asked, and you can't then go back and get a second chance. Now, I myself have had times where after I've met with an injured worker, I've scheduled another follow-up face-to-face examination within a week or 2 weeks or 3 weeks or a month or what have you. But that was because new information became available that was not available at the time of the first evaluation, and it created the need for some additional examination procedures or a new line of questioning, and that has happened to me, but I've never called a second evaluation due to my own omission. Something that I forgot to ask or something that I forgot to examine, and so you get one shot at it, and it has to be good and it has to be right. So preparation, like Alexander Graham Bell and Robert Schuller both said, are essential for creating a spectacular, persuasive report. So what are some of the things that you can prepare before you even see the injured worker? Well, number 1, you can prepare the report. There's a lot of things that you can do in your report prior to seeing the injured worker. For example, you can begin the report by inputting all of the patient demographic information. You can prepare the report by inputting the history section of your report. You can obtain the history through the medical records, and you can prepare that section of the report in advance. Now, that section of the report is going to be modified based upon statements that the injured worker gives to you during the examination, but you can prepare the history at least as it's known from the medical records, and you can do that in advance of even seeing the injured worker. You can prepare the review of records section of your report. That is a section of your report that is independent of the face-to-face meeting with the injured worker. Now, that's not to say that this section of the report is going to be complete, because it may be modified by additional medical records that become available as a result of your examination of the injured worker, as a result of your ordering additional diagnostic studies, as a result of receiving additional documents after the face-to-face meeting with the injured worker, etc. But at least you can mostly complete your review of records section prior to meeting with the injured worker. And this is a valuable exercise because many times during the face-to-face meeting with an injured worker, you may have a question may come up in your mind as to when were those MRI studies obtained, or when was it that you consulted with the specialist doctor, and when was it that you had that surgical procedure, and wasn't part of that surgical procedure a discectomy, or wasn't part of it a resection of the distal clavicle? In other words, certain details may come up during the interview with the injured worker that you will need to reference. And rather than search through the entire stack of medical records that you have in the file with you, it's much more expeditious to simply refer to the review of records that has already been imported into your report, and that can be done in advance. And that's a very valuable exercise. You can prepare the examination section of your report in advance. In fact, I recommend that you do, and the very best doctors do this in advance. They set up the entire examination, including every single test, every single measurement, every single maneuver and procedure that they're going to do. They set that up in advance and in sequence, and simply refer back to that, refer back to a copy of that, a printed out copy of that, to guide their examination. And you can set this up in advance by knowing what are the involved body parts with each particular case. In addition to the exam, you can set up for any possible diagnostic studies that you might need. For example, if you are examining an injured worker and it's, and this is just an example, but let's say for example it's 15 months to 24 months after the date of injury for a lumbar spine injury. And if there's a good chance that this injured worker will likely be permanent and stationary by the time you evaluate him, since it has been 24 months since the date of injury, you know in advance that you're going to be ordering lumbar spine x-rays, including flexion and extension views. You can prepare that referral in advance, because this referral for diagnostic studies, and I'm just talking about lumbar spine x-rays as an example, but it could also include MRI studies, electrodiagnostic studies, it could include an evaluation by a specialist. In other words, any additional procedures that you anticipate, you can prepare for in advance, because these procedures have to go through the authorization process with the claims administrator, and time is of the essence. So if you know that you're going to be likely, I say likely, it doesn't have to be absolutely for certain, but if you know that you're likely going to order diagnostic studies, go ahead and prepare that referral letter in advance and have that thing ready for the very minute that you're done with your examination. And also let your injured worker know, both in advance and also at the time of the examination, that you are ordering diagnostic studies. They need to be completed as soon as possible, and they need to be cooperative with you in attending those diagnostic studies so that you can complete your report at the earliest possible time. Finally, you can prepare your symptom questionnaires in advance of meeting the injured worker. In other words, if you know what the involved body parts are, and you know what the issues are as a result of reviewing the medical records, you can prepare your symptom questionnaires, have them already in a small stack and ready to go, and ready to hand the injured worker when the appropriate time comes up during the examination. What else can you prepare for? Well, you can prepare for the examination. You can prepare the examination form based on the body parts as you know those body parts to be involved with this particular case. Once you know the body parts involved with the case, you can then consider what are the possible permanent impairments that you're going to be examining for. And a little bit later in this program, I talk about how to examine for the permanent impairments. So in order to be able to examine for the permanent impairments, you need to know what the permanent impairments are in advance. What are the spinal impairments? What are the permanent impairments for the upper extremity? What are the permanent impairments for the lower extremity? You need to know those in advance, and you need to examine those in advance, and that needs to be prepared in advance to make sure that you get every possible measurement for every possible impairment and you don't leave anything undone because you can't come back. It has to be perfect the first time, and I'm asking you to commit to absolute perfection, and perfection is to be obtained by thorough and accurate preparation. You can arrange your instruments before the examination and make sure that you have every possible instrument that you're going to require. You can determine the examination procedures that are going to be required in advance. For example, if you know that your examination includes a head injury, let's say for example you had an injured worker fall off a ladder and hit his head, and you're going to do a general neurologic exam including a cranial nerve exam, you know that testing cranial nerve number 2, the optic nerve, that requires a Snellen eye chart. Do you have the Snellen eye chart out, available, and ready to go? As another example, doing a gait evaluation for permanent impairment due to gait disturbance. Excuse me. Evaluating for gait disturbance requires that you go outside and observe the gait and observe the injured worker walk up and down the parking lot. That's something that you need to prepare in advance and be anticipating in advance. Finally, for example, as another example, the spine exam requires the use of inclinometers, special instruments. So the point of this discussion is to make sure that you have all the appropriate instruments and all the examination procedures already laid out in advance. We talked about already preparing for diagnostic studies, and that requires that you consider in advance which diagnostic studies might be necessary. Prepare the referral in advance. Have it easily editable based on any last-minute changes, and also advise the examinee in advance that they'll be going for diagnostic studies. And some doctors do this by way of a confirmatory telephone call. For example, some doctors call the injured worker 1 to 2 days in advance of the examination to answer any last-minute questions, and this can also be done by your staff, to answer any last-minute questions, to provide directions to the facility, to remind them to bring in their completed intake forms, etc. And this is a good time to also inform the injured worker that it is possible that the doctor may be ordering diagnostic studies. We don't really know, it's too soon to know. But in the event that the doctor orders diagnostic studies, it is necessary for the injured worker to go for those studies as soon as possible, even same day, if possible. That's what happens when you're really prepared in advance. You have the injured worker go on the same day. That's not always possible, but certainly the next day or the next day after that are ideal in order to get those results back as soon as possible and to get your report done on time. So that can be done in the confirmatory phone call a couple of days in advance of the appointment. It's also done on during the face-to-face meeting with the injured workers to let them know that you need them to go for those studies right away, and can you count on them to go today or tomorrow, and can they get that time off work, and can they get in there on Saturday, whatever it takes to get those studies done as soon as possible. So the point is really to have all the documents that are necessary for insurance company authorization done in advance. And not only are they required for the insurance company, they're required for the imaging facility or the electrodiagnostic study doctor. They need to have the appropriate paperwork so that they can proceed. What else can you prepare? You can prepare the last-minute details or the minute details. For example, I made reference to the confirmatory call 3 days in advance to make sure that the injured worker knows that you're going to be expecting them at such and such a date and such a time with their forms completed in advance. And this can all be done by your staff. So it doesn't matter really who does it, just matters that it is done. If an interpreter is scheduled to attend the examination, make sure to call 2 to 3 days in advance and confirm the interpreter. Give the interpreter any special instructions. For example, it might be appropriate to have the interpreter arrive 20 minutes in advance of the appointment time in order to complete any paperwork or symptom questionnaires. Make sure to have all the phone numbers in your chart, and that is any phone numbers that the injured worker may have. Home phone, cell phone, work phone numbers. Have those numbers available in the event that there's any last-minute surprises and the injured worker is not in attendance in accordance with the instructions that you gave them. For example, if you ask the injured worker to come 20 minutes early and they're not there 20 minutes early, make sure that you have a phone number to call them 1 minute later. In other words, 19 minutes before the appointment, you start calling some numbers and find out how's that injured worker doing. Are they lost? Are they coming? And what's up? Make sure to have the chart laid out in the sequence of activity that you're going to be progressing through the examination. Make sure to focus on the key issues in the case. And what are the key issues? Well, they're the same, really. Pretty much case to case to case. There's only so many key issues. One is AOE, COE, of course. Second would be a diagnosis or diagnoses. Number 3, causation, and that refers to both AOE, COE, and also the causation apportionment of the permanent impairment, or I should say the apportionment of the permanent impairment based on the causation of the impairment. Permanent and stationary status is always a key issue, and then finally, of course, is what is the level of permanent impairment.